Welcome, everybody. My name is Lucia, and today we have a panel on mindful eating with our expert coach, Dr. Julie Rosenberg. Welcome, Julie. Thank you so much for being here today.
Hi, folks. Thank you, Lucia. It's a pleasure to be here. And this is one of my favorite topics, mindful eating. So I'm so happy to share this with you.
Thank you. We're very excited to hear all about it today and to hear everybody's questions. But before we begin, I want to let everybody know that this is an interactive panel, which means that you can ask Dr. Julie any questions you have throughout this whole session. You can do so by typing your question in the Q&A chat box or on the chat feature on the app. So with that said, I guess I'll begin with the first question that I have, and it's very general. Dr. Julie, what is mindful eating exactly?
So mindful eating stems from the practice of mindfulness. And when we practice mindfulness, we really practice being present, being in the here and now. And if we think about mindfulness, so often in our lives, we're not really where we are. And by that, I mean, with all the busyness of our society, we tend to be defocused on what we're doing in the here and now. So if we take that position of being focused to our eating, mindful eating is really being present, being aware of your food, of your meals, and when you're eating, being there with eating instead of elsewhere or on the go. And I think that mindful eating offers so many opportunities to enhance our lives. And that's what we're going to be talking about more today.
I'm very excited to hear about this. I know we were chatting earlier, and I think it would be a great idea right now to do a bit of a focus practice so we can, absorb all what we're going to learn about mindful eating. What do you think, Dr. Julie?
Absolutely. So, for those of you on the conference today, if you'll just take a comfortable seat, if you're not already sitting, and I like to sit with my feet planted on the ground. It's personal preference. You might want to sit cross-legged on a cushion. And with me and with you, Lucia, if you'll just gently close or put your eyes for just a moment and feel a sense of peace and calm come over your body. Feel your feet on the ground and your seat on the chair, and then slowly from your belly, take an inhale up into your chest and hold it for a silent count of 3. And then exhale slowly. Feel the breath leave your body and feel your body settled. And then take a pause for a moment, and we'll do that just one more time. Inhale from your belly, up into your chest. Feel your chest expand with that fresh oxygen. Hold it for a count of 3. And then exhale, chest, belly, and gently open your eyes and see how you feel. How do you feel, Lucia?
I feel wonderful, very focused. I think the breath is always a great practice to focus, and that's exactly what this did. So thank you so
Right.
much for
That's
this.
great. And just for everyone else to also think about, that practice was about 30 to 40 seconds. I didn't time it. But think about that throughout your day when you feel a little bit unsettled. It's a good way to settle yourself, just a few breaths.
Thank you, Dr. Julie. And I encourage everybody in the audience to, tell us how you feel. Today's topic, going back to it, is mindful eating. And I think mindful eating is a little bit also about focus and being in the present moment. And I guess one of my questions is a little bit related to, what are the benefits of eating mindfully, for instance? What are the health benefits?
So there's many health benefits, and they can really be multifactorial, Lucia, but I think I'll just start with our digestion. So we tend to eat quickly, and we tend to grab and go, and we eat at many different times during the day. And we also often don't pay attention to what we're eating. So if we eat mindfully, our choices many times are going to be more healthful, and we pay attention to whether we're hungry or full, and we pay better attention to what we're eating. And all of that leads typically to better digestion, that slower eating and that awareness of eating. Because what it'll also do is help you to be able to discern whether or not foods are bothering you. For example, I can't drink milk or ingest milk products. They really bother me. If I didn't pay attention to it and I just drank a lot of milk or ate a lot of ice cream or this or that, I would say I probably would really have a lot of stomach pains. But I really came to this awareness by eating a little more mindfully and slowly and paying attention to the foodstuffs that were typically bothering me. And that's what I mean by it can improve our awareness, and we know what foods we can tolerate and not. And because we're not shoveling in the food as we often might tend to do in our hurried lives, it does allow our digestion to take place more effectively.
Thank you, Dr. Julie. I can actually myself relate to that. I am plant-based, and one of the reasons why is because I am not able to digest a lot of the foods. And in order to understand that, I had to sort of pay attention to everything that I ate. So it kind of falls within this mindful eating pattern that we're trying to I guess develop. One of the things that I think about when I think of eating is weight loss. A lot of the times people are wondering, will mindful eating help me with weight loss? And what are your general thoughts on that?
Well, first and foremost, just for everyone's awareness, mindful eating is not a diet and it's not meant as a diet. So I actually think it can be more helpful because it's not restrictive. The way that folks can lose weight with mindful eating is really through that awareness, because we have this tendency to grab and go, like I was saying earlier. And if we actually can sit down when we're eating, if we actually can take a pause, can think about what we're prepare with a little more care. And, it even starts with selecting the foods at the store or at the farmer's market that we're going to eat with a little more care. Then what can happen is that with this awareness, we may not eat as much. And we also may just eat until we're full instead of past full, as we often might do if it's there for us or if we're not preparing it ourselves. Or if we're in an environment where we're just grabbing the food, we're not preparing it mindfully, we're not eating it mindfully, we're not being thoughtful about it, we're just grabbing. So it's this practice over time that's really helpful in being able to shift our way of thinking about food and our way of eating. And that can lead to some weight loss and stabilization of weight over time. So it's really a valuable habit in my mind.
I agree completely. Makes a lot of sense too. A question that kind of sort of falls under what we were just talking about. What if a lot of things, for me at least, I don't have a lot of time to eat. I have, let's say, maybe 20 minutes or so. What are your recommendations for somebody that's very busy and that doesn't have the time to sit and mindfully eat all the time? What can we do?
Well, I think even if you only have the 20 minutes to eat, as you suggested, or possibly less, many people who work are afraid that their productivity is going to suffer or they don't make time for lunch or breakfast even. And I really encourage everybody to try to make that time, even if it's a few minutes, like 10 minutes. Then what you can do is pre-prepare your food. I think pre-preparing and actually thinking what you're going to eat that next day and possibly pre-preparing and even writing it down in a calendar can help you know more about what you're eating. And then you're more apt to pull it out, say, of the refrigerator, and you can be more quiet and peaceful while you're eating. I can promise you that my own experience and studies show that if you eat in a balanced way on a schedule, that in actuality, your productivity will increase because your blood sugar balance and your overall nutrition balance will be better, allowing you to think better and feel better. So I think it's worth it. I can say that personally, I, like everyone else, have a really busy schedule and I take time. I typically eat 3 meals because I need it. And I really take that time no matter what to eat. And I really try to eat sitting down, whether I'm by myself or with others. Again, it's a learned behavior. I wasn't necessarily always that way, but I would encourage you to do it. And you can expand your time. So if you have 10, 20 minutes to eat, you really can eat if it's pre-prepared and if you're thoughtful about it in a shorter period of time.
Thank you, Dr. Julie. I really like that idea of, eating at the same time every single day. I try to follow that schedule too. It has helped me in the past. Another question I had, this is more related to cravings. A lot of the times, things that happen when you're eating is that we crave sweet foods, or we crave fatty foods. How does this relate to being stressed, and how can we sort of use mindful eating to stop these cravings?
So I think that the cravings are challenges for all of us. And the first and foremost, if we eat mindfully, we know what we're eating. So if we're stress eaters, and typically it's those fatty or salty foods, it's chips and pretzels and crackers and cheeses and things like this people like to grab. And I think honestly, I don't tell people, get that out of your diet, because I don't think it's practical. If you really like something, it's typically not practical to omit it. That's how come people tend to yo-yo diet so much. They feel so restricted. But I do think it's really helpful to set out portions. For example, rather than put that bag of chips on your desk and just grab it and not think about it, what if you had a portion of chips in a small bowl and you had an apple to satiate your hunger? That apple obviously is giving you nutrition. The chips might be something that you like to eat, so be it. But when you eat that bag of chips, you're probably eating 6 or 7 portions and you're not even recognizing it. So your salt load goes up, your fat load goes up, your calories go up. And the whole practice of mindfulness is just, honestly, it's about that awareness. The more aware you are, the more sometimes you can actually even control your overall stress, because you become more aware with habits like mindful eating of what is actually stressing you out. Sometimes we feel stressed and we don't even know what's stressing us out. So just that whole practice of mindfulness can help us settle and feel more grounded and less stressed. And then for the eating, it's really those habits that we can perform that help us stay more grounded and can actually control our intake, and our observance of our food also controls how much we eat and what we eat. Does that make sense?
Yes, makes total sense. What I gather as well from what you're saying too, it's that a lot of it is about preparation and being sort of prepared with the foods that you're going to eat. So you're not caught off guard and making impulsive decisions when it's about, time to snack or something.
Right. I agree with that 100%. But I also think it's about being kind to yourself. Our worlds are busy today, as we all know. And sure, if you love chocolate, if you love pretzels, a little bit, I think, as long as it's not something you're intolerant to, a little bit probably isn't going to harm you. It's that excess that harms us. And if we can get down to thinking in a more balanced way and practicing our eating in a more balanced way, it really will support us in greater ways than I think we know in the here and now. Because what I want people to do is to eat well on a continuum. And so that knowledge is the first start of eating well. It's understanding what you're eating, how much you're eating, and what foods serve you and what foods don't. And then, you'll see the benefits. When you see the benefits, it becomes easier to practice.
Makes a lot of sense. Actually, I have a question or a comment here related to what we were just talking about. An anonymous attendee says, I have a tendency to eat more when I'm stressed, especially chocolate. I do too. So I can definitely relate. Is there a reason why sometimes we crave salty foods or, versus sugary foods?
Well,
Does that have anything to do with it?
chocolate actually has some substance in it that help us release endorphins. I'm not sure about the salty foods, quite honestly, but when we release endorphins, we feel better, especially dark chocolate. So it can be associated with feeling better for some people. And it is obviously a go-to food. People like chocolate for different reasons, but that release of endorphins does help people feel good. So again, I'm not suggesting that you omit chocolate totally from your diet. What I am suggesting is that, say you buy a chocolate bar and it has 6 portions. I'm suggesting maybe carry that out over 3 days, 1 or 2 small portions a day, rather than eating that whole bar in one sitting and then going and grabbing another one. That may really be a learned behavior that serves you without causing you distress. And then I think salty foods are a go-to for many people, and they just, it's an easy grab, and it's inexpensive for the most part, and people like it. So it's just a go-to, and it's a bag oftentimes, like the pretzels or the peanuts or the potato chips or what have you. And typically we go to that. And that's why I'm saying, if you like other things that might be a bit more healthful, perhaps integrate that in your preparations. And again, I'm not telling you never to eat it. I'm just suggesting if you prepare in advance, maybe there will be other things like apples and carrots and hummus and things like this that actually you might come to like. I've definitely come to like these healthy foods over the years because I feel better. I feel much better if I eat that way. And that's key, feeling good.
I love that. And I agree completely with, your body needs to feel good to be able to be nourished. There's another question here. Nosa says, does meditation help keep your blood pressure stable?
Yes, so it's a little bit off mindful eating, but absolutely. And actually, thanks so much for the question. There's a number of studies that have shown this. It is helpful in patients with hypertension. Now, let me be clear. If you have high blood pressure, I always need to preface my comments with, you should see your doctor, you should monitor your blood pressure. And if you're on medications, meditation in and of itself is not necessarily a key to just stopping your medications. But with high blood pressure, meditation can be very helpful because it calms the parasympathetic nervous system. It calms the body down. And as I said, in scientific studies, it has been shown to help keep blood pressure at a continuum at a lower level. So I strongly recommend this for patients with really any type of chronic disease. I think that meditation is quite helpful. And to again, readdress the question, certainly it can help with high blood pressure.
Thank you, Dr. Julie. That's a great advice as well. I think a lot of people probably have that question. I myself have a very similar one coming up. Can mindful eating or eating the right foods for you help prevent, illnesses or discomfort or anything that we might feel physically?
Well, I think so much of our diet, especially the Western diet, is not necessarily healthful. I think everyone knows that the rates of, overweight and obesity in the United States and in so many regions really are very eye-opening. They approach 70 to 80% in some region, and that's very concerning. And so what mindful eating can do for each of us is really make us aware of what we're eating and hopefully modify our nutrition. It's been stated many times that food is medicine, but it's really true. Our diet can really help prevent so many diseases, especially cardiovascular disease and stroke, and it can help with our digestion, that it really makes sense to pay attention to what we're eating and to choose healthful foods. I personally like organic foods, but to choose healthful foods and to integrate those foods in our diets and to really watch the amount of saturated fats and, meats for those who eat meat, and the heavy carbs that we're so inclined to eat, to watch those and be thoughtful about our ingestion of those types of foods. So yes, it can really be multifactorial, and this is health for life, so obesity is associated with a multiplicity of disorders, from heart disease to cancer to stroke to many causes of morbidity and mortality. And so if we can control that in ways that are thoughtful, that we actually like and can embrace for life, our health for sure will be better, all of us.
Thank you, Dr. Julie. That actually makes a lot of sense as well in terms of being able to eat the right foods. I want to remind everybody we have a couple minutes left, and if you have any questions for Dr. Julie about mindful eating, about the foods that you're currently eating, and any advice that you want to obtain from Dr. Julie, this would be the time to type it in the Q&A chat box. One thought that I had, and as you were talking as well, was in terms of mindful eating and dieting. What are I know that dieting is not the best way to go about it, but is there a specific diet that works to keep you healthy, or how does that normally work?
I would say that we need a balance of carbohydrates, good fats and protein. And some people need more than others. If you have a plate and you divide it into sections, I would say that at least 2/3 of your plate should be covered by, vegetables, which are very good, or low glycemic index fruits with the vegetables. And low glycemic index fruits just don't have a lot of sugar. There are things like green apples and berries. Berries are a wonderful food. I actually personally eat them every single day. And if I miss a day, I don't feel well. So they're actually a really good food, full of antioxidants and low in sugar. So if you have plant-based diet, you'll cover about 2/3 of your plate with plants. And as we've been talking about, and you probably know that, Lucia, yourself from your existence in the vegan way. And then for those who eat meats, lean fish, lean protein, lean chicken, and, some forms of beef and pork, they're leaner. And that might cover another quarter of what's left. And then, the non-trans fats, like some of the avocado oils and the olive oils are good to eat, and you really want to stay away from saturated fats. And in so doing, you have really sort of a whole diet on a continuum that hopefully will help you feel well and will serve your state of health. And then one thing that's not on your plate is what you drink. You need to drink a lot of water. And, I think that for people to really be mindful of the artificial sugars, the diet sodas and things like that, it's not necessarily an alternative to water and other things that just are more natural substances. So know what you're drinking as well as what you're eating. I think it's really helpful. And then you may find that you feel better and you have better weight control. And that's, key for all of us. We just want to feel well. And I think when we feel well, for those who are worried about taking that time out of the day of their work, we're more productive. And that's always a good thing.
Totally agree with that. Dr. Julie, kind of striving from this question, but still in a related note, are there foods that are better ingested in the morning to be able to get the most sort of value out of them, or at night? What are your thoughts on that, specifically on the time of day to ingest certain foods?
Well, what I can say about that is I think that it really is important to eat breakfast. I can't necessarily advise on the specific foods that each person should eat, because I think, as we've been sharing, different people tolerate different things. But I do think some protein in the morning is helpful to stabilize your blood sugar, and it helps you feel better. So that carbohydrate load, for example, that biscuit and coffee or that bagel and coffee, without some kind of protein, that's a heavy load of carbohydrates and ultimately simple sugars that may not agree with many folks. Certainly, it doesn't agree with me. Now, some people can eat that and they feel just fine. But on a continuum, it's good to have some protein and maybe a lesser amount of carbohydrate in the morning. Then at night, it's really smart. It's not 100% for all of us, but it's smart not to eat 2 hours before you go to bed. And that is because people have a harder job when they are laying flat to digest their foods. And they have reflux, and acid reflux is a major problem with folks that eat a big meal at night and go to bed relatively full. So it's better not to eat 2 hours before you go to bed. And then, of course, we mentioned a midday meal. I think it's actually better. They do this in Europe. We don't do it so much in the States. It's really better, I think, to eat a larger quantity of food at a noon hour, and then a smaller meal typically at night. We kind of had the reverse habits here. It may not always be possible for folks, and I understand that. I'm often guilty of that as well, just due to time constraints. But it's really good to eat your meal a couple hours before you go to bed. And again, that balance, I think, is key. And knowing what foods may bother you in some way or another is also key. Does that make sense?
Totally. It makes total sense. I myself personally feel much better when I don't eat too close to bedtime.
Mm-hmm.
That's definitely a no-no, but I'm really glad that you mentioned that as a key thing.
Mm-hmm.
We're getting really close to the end of this session. It's been very helpful, Dr. Julie, very informational. I think it would be great to close it out with some sort of focus meditation. What do you think?
Sure. So why don't we conclude as we started? And let's just gently close our eyes and thank yourself for sharing this time with us today. And I hope that it was meaningful for you. And I hope that your practice of mindful eating, if it hasn't already started, will begin now. And so together in our seated positions with our feet on the ground, our spines erect and our position of comfort, take a deep breath from your belly up into your chest and hold it. And count silently to 3 and then let it out. And in our last moment together, take a second deep breath from your belly up into your chest. Hold it for a moment. Pausing and slowly let it out. Then gently open your eyes. Check in with yourself. And Lucia, thanks for inviting me and thanks for joining me today. And everyone, thank you so much. Namaste to your mindful journey.